My mummy cat's autoimmune diseases and other conditions. I need to talk to someone. I would appreciate it if you would hear me out, because I, Coffee Cat, am very worried about my mummy cat. I am aware this is an unusual topic, but here are a list of some of her diagnoses and what they mean for her. Agoraphobia is an anxiety disorder characterized by an intense fear of being in situations where escape might be difficult or help might not be available if things go wrong. This fear often leads to avoidance of various situations and places, significantly impacting daily life. Symptoms. People with agoraphobia may experience anxiety in situations perceived as unsafe, such as public transport, shopping centers, or crowded places. Panic attacks, which can include rapid heartbeat, hyperventilation, sweating, and nausea. Avoidance behaviors, such as not leaving home at all, like mummy cat, or only going out with a trusted companion. Causes? Agoraphobia can develop as a complication of panic disorder, where panic attacks are associated with specific places or situations, leading to avoidance. Other potential causes include genetic predisposition, traumatic or stressful events, overprotective upbringing, major depression and anxiety. About 56% of patients with major depression have comorbid anxiety disorders. The lifetime comorbidity of anxiety disorders with major depression ranges from 20 to 70%, depending on the specific anxiety disorder. People with comorbid anxiety and depression tend to have more severe symptoms, greater impairment, compared to those with depression alone. Comorbid anxiety predicts worse treatment outcomes for depression. Depression often includes symptoms similar to anxiety disorders, such as nervousness, irritability, and problems with sleep and concentration. Some anxiety disorders, like social phobia and generalized anxiety disorder, often precede the onset of major depression, while others, like panic disorder and agoraphobia, are more likely to develop after the first depressive episode. Treating both anxiety and depression is crucial for improving overall mental health and functioning. Fibromyalgia is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, and tenderness throughout the body. People with fibromyalgia experience heightened pain sensitivity, as their brains process pain signals differently. Common symptoms include widespread pain, fatigue and sleep disturbances, cognitive difficulties, fibro fog, mood issues like anxiety or depression. The exact cause of fibromyalgia is unknown, but it may involve genetic factors, infections, physical or emotional trauma, or other illnesses. While there is no cure, treatments can help manage symptoms through a combination of medications, exercise, relaxation techniques, and cognitive behavioral therapy. Fibromyalgia is more commonly diagnosed in women and tends to develop in middle age, though it can affect people of any age or gender. The condition often coexists with other health issues like irritable bowel syndrome, chronic fatigue syndrome, and migraine headaches. Hashimoto's hypothyroidism, also known as Hashimoto's disease or Hashimoto's thyroiditis, is an autoimmune disorder where the immune system attacks the thyroid gland, leading to inflammation and reduced thyroid hormone production. This condition is a common cause of hypothyroidism, underactive thyroid. Symptoms. Symptoms of Hashimoto's hypothyroidism can vary in severity and may develop gradually. Common symptoms include fatigue, weight gain, sensitivity to cold, constipation, dry skin and thinning hair, muscle and joint pain, depression or low mood, cognitive issues such as poor memory and difficulty concentrating, enlarged thyroid, goiter. Causes? The exact cause of Hashimoto's disease is unknown, but it is believed to involve a combination of genetic and environmental factors. Family history of thyroid or other autoimmune diseases increases the risk. Other potential triggers include viruses, bacteria, and stress. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis chronic fatigue syndrome, ME/CFS, is a complex disorder characterized by extreme fatigue that cannot be explained by any underlying medical condition. The features of CFS include severe fatigue lasting at least 6 months that significantly reduces a person's ability to carry out daily activities. Post-exertional malaise, PEM, where symptoms worsen after physical, mental, or emotional exertion. This can lead to a cycle of pushing and crashing, with recovery potentially taking days or weeks. Unrefreshing sleep, where people wake up feeling just as tired as when they went to bed. Cognitive difficulties, often described as brain fog, which can include problems with memory, concentration, and information processing. Orthostatic intolerance, where symptoms worsen when standing or sitting upright, potentially causing dizziness, weakness, or vision changes. Additional symptoms may include pain, muscle pain, joint pain without swelling, headaches, tender lymph nodes, sore throat, digestive issues, sensitivities to foods, odors, chemicals, light, and noise, muscle weakness, irregular heartbeat. While there's no cure for CFS, proper management can help improve quality of life for those affected by this condition. Diverticulitis is a condition characterized by the inflammation or infection of small pouches, called diverticula, that can form in the walls of the digestive tract, particularly the colon. These pouches are common, especially in older adults, and their presence is known as diverticulosis. When these pouches become inflamed or infected, it leads to diverticulitis. The symptoms of diverticulitis can range from mild to severe and may include constant or severe abdominal pain, often on the lower left side, nausea and vomiting, fever and chill, abdominal tenderness and bloating, changes in bowel habits, such as constipation or diarrhea, blood in the stool or rectal bleeding. If left untreated, diverticulitis can lead to serious complications, including abscesses, pockets of pus, perforation of the colon, leading to peritonitis, infection of the abdominal cavity, fistulas, abnormal connections between organs, intestinal obstruction. Bradycardia and tachycardia occurring in the same person, is known as Tachy-Brady syndrome or tachycardia-bradycardia syndrome. This condition is characterized by alternating episodes of fast, tachycardia, and slow, bradycardia, heart rates. Here are the main points about this syndrome. Tachy-Brady syndrome is a heart rhythm disorder where the heart fluctuates between beating too quickly and too slowly. It often develops in people diagnosed with sick sinus syndrome or atrial fibrillation, AFib. Common symptoms include fainting or near fainting, heart palpitations, sensation of skipping, slowing down, or racing heartbeats, lightheadedness, fatigue, shortness of breath. Tachy-Brady syndrome is often caused by damage to the sinus node, which is responsible for controlling the heart's rhythm. Individuals with Tachy-Brady syndrome may have a higher risk of stroke. Chronic syncope. Chronic syncope refers to recurrent episodes of fainting or passing out. Here are the facts about this condition. Syncope is caused by a temporary drop in blood flow to the brain, leading to loss of consciousness and muscle control. Common symptoms before a syncope episode include lightheadedness or dizziness, nausea, sweating, pale skin, vision changes, blurring, tunnel vision, seeing spots, feeling weak or faint. Causes of chronic syncope can include vasovagal syncope, most common type, low blood pressure, irregular heart rhythms, dehydration, prolonged standing, emotional stress or pain, certain medical conditions. Vasovagal syncope occurs when the nervous system malfunctions in response to a trigger, causing a drop in heart rate and blood pressure. Management of chronic syncope may include identifying and avoiding triggers, staying hydrated, changing positions slowly, lying down or sitting with head between knees when feeling faint. In some cases, medications or other treatments may be necessary. Diabetes 2. Type 2 diabetes is a chronic condition characterized by high blood sugar levels due to the body's inability to properly use insulin or produce enough insulin. Here are the important points about type 2 diabetes. The symptoms are increased thirst and frequent urination, increased hunger, fatigue, blurred vision, slow healing sores, unexplained weight loss, numbness or tingling in hands or feet. Many people may not notice symptoms initially, as they often develop slowly over several years. The complications if left untreated are cardiovascular disease, kidney damage, eye problems, retinopathy, nerve damage, neuropathy, foot problems, skin conditions, increased risk of dementia. So, this is why I worry. All of these things overlap and interact and cause Mummy Cat to be overwhelmed by the symptoms. She still smiles and laughs though, but the doctors know her time is short and so do I. Mummy Cat is brave and she's doing the best she can, but in the 2.5 years I've known her she has declined terribly. She is now confined to bed, she can only just walk a little, and she has a wheelchair. Having a shower even, leads to shaking uncontrollably and may use up all her energy for the day. She is worried that she may be unable to attend her daughter, Christy's, wedding in 3 months, as she knows the agoraphobia may not allow her to leave the house, but she's going to push hard to make it happen. Mummy Cat has a good deal of knowledge on these subjects and is happy to share her experiences with anyone who needs help with coping with them. Please tell me, in the comments, if you found this at all useful or interesting, and watch the next video on the top of the screen for a subject a little lighter.